Well, good afternoon, everyone. My name is Mike Good. I have the honor of serving as the Chief Executive Officer for University of Utah Health. And this afternoon, I have the pleasure of telling you about how we at the University of Utah engage students in our innovation ecosystem, and specifically our Bench to Bedside program. I want to give a shout out to Justin Brunson, who's here with me. Justin is our Director of Operations and is really both the innovator and the driving engine, the passion that makes this program so successful. Let's begin by talking about cervical cancer. This is a global challenge. Every 2 minutes, a woman somewhere on the globe dies of cervical cancer. It's the #1 cause of cancer-related deaths in developing countries. Most women who die from cervical cancer live in remote areas, remote villages, and they have no access to health care. And this includes common prevention mechanisms, such as HPV vaccines. These are inaccessible in large parts of our globe. With this global medical need in mind, a former physician and industry mentor approached the Center for Medical Innovation at the University of Utah, where he was introduced to the students in our Bench to Bedside program. The students formed a team, in this case 2 medical students, 2 engineering students, and a business student, and embarked upon their innovative journey. We'll come back to their story in just a minute. The Bench to Bedside program is about to begin its 15th year. It's a 7-month annual program for students of all disciplines, and they come together to try to tackle some of the world's greatest challenges. They include students from medicine, business, engineering, science, law, art, virtually all the disciplines on our campus, and they form interdisciplinary teams. We've heard a lot about that throughout the conference today, and I think one of the reasons interdisciplinary teams are so important is that true innovation occurs not within a discipline, but at the interfaces of 2 or more disciplines. So each student on these interdisciplinary teams brings distinct knowledge and perspectives to tackle the healthcare challenge they have identified. During the 7 months, they learn from industry experts who teach them how to clearly articulate the clinical problem, how to evaluate market opportunity and patent landscape. They establish a regulatory pathway. They create the proof of concept prototype, and they develop a go-to-market strategy for commercializations. Throughout the year, the students also participate in networking events where additional industry experts are brought in to review and provide feedback to their evolving projects. The Center for Medical Innovation is the home of the Bench to Bedside program. The center offers a comprehensive suite of resources that are needed to accelerate this innovation process. So this includes advanced prototyping equipment. Every few months, I'm asked to buy another 3D printer, the CNC milling machines, and electrical prototyping equipment, among others. Again, we also have professional engineering support to give particularly our non-technical innovators a method for developing their proof of concept prototypes. And then regulatory expertise to help med tech inventors establish a pathway for U.S. FDA and global regulatory approval. As this center has continued to grow, we recently broke ground on our new 60,000 square foot James Lavoie Sorensen Center for Medical Innovation. James Lavoie Sorensen, although born in Idaho, had his entire career in the state of Utah. Sorensen has over 60 patents. Some of them you may be familiar with. He patented the first disposable face mask. He patented plastic IV catheters, replacing the then needle catheters known at the time. and also the continuous flush device that allows arterial lines and central venous lines to maintain patency and not develop clots at their tips. So an appropriate namesake for our center. So in this facility, we'll build on the existing legacy of this program and really provide a state-of-the-art center for our future innovators on their journey, their innovation and invention journey. The state-of-the-art facility will also include a clinical surgery discovery room where teams can actually evaluate their prototypes in either simulated or in some cases with animal or human tissues, depending on the nature of the device, can be tested and iterated in these realistic environments. We will also have startup space or incubator space for our startups. Right now, we have fledgling startup teams, often 2 or 3 individuals, and it's a little bit overwhelming to say, oh, go rent a space downtown or in Research Park. So we'll have almost a dozen spaces where those that are just beginning their startup will find a welcoming home and can grow till they're really ready, as the metaphor goes, to fly and leave the nest. The Bench to Bedside program culminates each year in the Bench to Bedside competition. Each year we hold this. We have it in our state capitol. This is the rotunda of our beautiful state capitol. The projects are showcased during the early part of the evening, and then we draw a large audience of investors, faculty, physicians, industry experts, importantly, legislators and government officials. A panel of judges then determine which projects will be awarded over $100,000 of milestone funding each year. So let's return to the global challenge of cervical cancer. In 2015, Sinluma won the grand prize in the Bench to Bedside competition. The students used the funding they received, they were awarded, to attend additional training workshops, meet with additional healthcare professionals in our health system and other health systems, and they utilized the prototyping capabilities at the Center for Medical Innovation to build their first prototype called Sinluma. The team continued to work on their device and formed a company with their mentor. Now, over the next 18 months, the company finished development on the device and received both FDA approval and a CE mark. Sinluma is a portable, battery-powered, easy-to-use pre-cervical cancer treatment device. Using thermal coagulation, the device can treat pre-cancerous lesions in the cervix in low-resourced communities. The company continues to impact the lives of patients at risk today. To date, Sinluma has been used to prevent cervical cancer in over 500,000 patients worldwide in more than 80 countries. Fast forward to today, and we just completed our 2024 Bench to Bedside competition. This year's winners included C-Blue, Orthobolt, and SoundPass. So C-Blue, created by a team of engineering and psychology students, uses specificity and sensitivity improves specificity and sensitivity of cervical cancer screening through a novel blue light colposcopy that uses the fluorescent properties of cancerous cells, which are different than non-cancerous cells, to make the precancerous lesions more easily detected by clinicians. Orthobolt, from a team of medical, engineering, and MBA students, created a technology, an expandable pedicle screw designed to go into osteoporotic bone that doesn't have all the same stiffness and integrity as healthy bone. These screws offer optimal anchoring in both healthy and compromised bones and reduce the risk of complications associated with traditional screw fixation. And finally, SoundPass, a team of medical, engineering, public health, and MBA students created a revolutionary ultrasound guidance system for when neurosurgeons need to place drains at the bedside, a procedure that had been traditionally done by landmarks or without visualization, and by placing a special ultrasound crystal on the tip of the stylus, they can help the neurosurgeon actually visualize to guide precise placement of the ventricular drain. We could go on to summarize a 14-year experience. The Bench to Bedside program has trained over 1,700 student innovators, developed 350 technologies, filed over 200 provisional patents, and awarded over $1.5 million in milestone funding. And the program creates more than medical devices. Each year, up to 200 students participate in this program. They learn to think differently, like innovators. They learn to see the world differently, like innovators. And they recognize opportunities to improve on the status quo and then take action. For example, one of our graduates is Josh Lyman. Josh was in the Bench to Bedside competition in 2020. He and his team set out to ease the ability for physical therapists and athletic trainers to use both hot and cold treatment modalities in a single device. After Josh graduated, he went on to the mergers and acquisitions team at Intuitive Surgical. And as Josh, to quote him directly, Bench to Bedside was incredibly valuable as I moved to the corporate world. The lessons learned were hallmark to me as I engaged in mergers and acquisitions and strategic partnerships with startups. It added a level of personal credibility, helping me to be understanding and empathetic to the strategic challenges they are facing. So in summary, like your university, the University of Utah is known for its many innovations. Many don't know, but the very first grant from the National Institutes of Health was awarded to Dr. Max Wintrobe at the University of Utah. The BRCA breast cancer gene 1 was discovered at University of Utah and commercialized into Myriad Genetics, now one of the leading molecular genetics firms in the world. Dr. Mario Capecchi developed the gene knockout mouse, the animal that is used in genetic testing now worldwide, and for that he won the Nobel Prize. Current day inventions including a robotic prosthetic hand, a bionic leg, gene therapies treating loss of vision and loss of heart function, and neurotech, which is based on the Utah Array. It's a brain-computer interface, the most widely used in the world, with earliest implants now dating back to 2004. At the University of Utah, the Center for Medical Innovation serves as a hub for this type of ingenuity, this type of innovation. But if you really want to supercharge your innovations, as we have, engage your students. I'll just close by noting that Justin Brunson and I will be at the Connections reception between 4 and 6 this evening if you'd like to learn more about the Center for Medical Innovation and the Bench to Bedside program. If I'm looking at the timer right, we have questions for maybe time for 1 or 2 quick questions. Yes.
I'm close. Tim Randolph, St. Louis University. Brilliant. So how do you create the list of project opportunities for this program? How's the list of projects created?
Yeah, it's kind of a mixture. Often one or more of the students will bring the idea. We also have a group of faculty advisors. I'm an anesthesiologist. I'm quite proud our department has a couple of advisors. And if students are looking for projects, they'll suggest avenues and ideas. I think the part that really just continues to impress me is the interplay between, we hear a lot from medicine, engineering, business, occasionally psychology, education. Law is often involved in the regulatory piece, but again, it's kind of a mixture, some from the students, some from the faculty, some from the staff. We end up with more ideas usually than we have teams. So thank you. Thank you all again, and if we can discuss more, we'll see you at Connections later this afternoon. Thank you.